name's Catherine Fry, and I'm going to be your nurse today. Can you please go ahead and tell me your name and date of birth while I do hand hygiene?
Hi, I am Jackie Marie Vascular, and my birthday is June 20th, 2001.
Okay, perfect. And can I go ahead and take a look at your patient identifier? Okay, perfect. So I'm going to ask you a few questions. Is that okay?
Yep.
Okay. So what brought you in today?
I've been having a little bit of trouble breathing.
Okay. And what is it like when you do have trouble breathing? Is it wheezing or something else?
Yeah, there's a bit of wheezing, and when it happens, I can really only get like half my air into my lungs. But it really only happens when I'm like exercising or like doing like a lot of stuff.
Okay. And when did this begin?
Maybe a few weeks ago.
A few weeks ago. So do you get pain or tightness in your chest when this happens?
No.
No? Okay. And so does this come and go, or is it more constant when it happens?
No, it comes and goes.
Comes and goes. And you said that it comes and goes when you are exercising or overexertion?
Yeah.
Okay. And you feel lightheaded or dizzy at all when this happens?
No.
No? Okay. And when this does happen, do you have any other symptoms during these episodes, like chest pain or coughing?
No.
Okay. Okay, so I'm just going to ask you a few questions about your own personal health history then.
Okay.
So do you have any, like, chest pain? You said you did have trouble breathing, right?
Yeah.
Okay, so do you have any chest pain?
No.
Okay. Do you have any trouble breathing when you lay down?
No.
No? Okay. Do you have any cough or fatigue?
No.
Okay. Have you noticed, like, any swelling or edema in your limbs at all?
No, nothing like that.
Okay. And do you find that you frequently have to get up at night to go pee at all?
No.
No? Okay. And then for your own history, do you have a history of like diabetes, high cholesterol or hypertension?
No.
No? Okay. And then for your family history, do you have hypertension or obesity at all?
On my mom's side, my mom has hypertension.
Okay, she does. And then do you have any history of coronary artery disease?
No.
No? Okay, that's good. How much would you say you use tobacco or smoke at all?
I just took up smoking, usually about half a pack to a pack a day.
Okay. And do you drink alcohol at all?
Occasionally, about like every other weekend or so, I have a few drinks.
Okay. And then you try to exercise?
Usually about like half an hour to an hour every day when I can.
Okay. And do you take any medications for anything?
No.
No? Okay. Just a few more questions. Do you have any like leg pain or cramps at all?
No.
Okay. Have you noticed like any skin changes in your arms or legs?
No, nothing like that.
Okay. And you said you don't have any swelling, correct?
No.
Okay. So, can you please tell me where you are today?
I'm in the hospital.
Okay. And do you know why you're here?
I've just been having some chest pain. Or no, not chest pain, trouble breathing. No chest pain, I promise. And just trouble breathing.
And can you tell me the date of today?
Today is December 1st
Okay.
of 2020.
Okay. And can you go ahead and take your right hand and touch it to your left shoulder for me? Okay, perfect. So I'm going to go ahead and check your pupils and everything. Could you please remove your glasses for me? Okay. So I'm just going to bring it across your eyes to look. So it's going to be a little bright, but don't worry. Okay. I'm going to go ahead and do it one more time to make sure your other eyes working good. Okay, perfect. So your pupils are equal, rod reactive, just like we want to see. And then next, I'm going to have you, if you want, you can put your glasses back on. But I'm going to have you try and follow this light for me, okay? So next I'm gonna go ahead and check your mucous membrane. So I'm gonna take this and stick it on your tongue so I can see back in your throat. Is that okay?
Yep.
Okay, go ahead and open for me, please. Okay, thank you. They look nice and pink and healthy. So next I'm gonna check for your facial symmetry. Can you go ahead and smile for me? Okay, and then can you raise your eyebrows? Okay, perfect. So, can I go ahead and take a look at your hands and legs real quick? Okay, you have nice, good color, warm, not moist, nice and dry. And then can I go ahead and take a look at your feet, please? If you want, you can go ahead and stick them up on my leg. Okay, perfect. And now can I check your nail beds?
Yep.
And cavity refill? Okay. Okay, good. Less than 2 seconds. Good. Okay, go ahead and stick your feet up here. Okay, perfect. So I'm gonna go ahead now and do hand hygiene again, just because I touched your feetsies. And so next I am going to take your, now is when I would take your vitals. So, yay. And so next I'm gonna go ahead and auscultate your carotid, but before I do that, I'm gonna go ahead and sanitize my stethoscope, just so you don't get the germies. Okay. Okay, and then I'm just gonna make sure to do it one at a time. Okay, sounds good, no throughs. Okay, also sounds good, no bruise. So, next I'm gonna go ahead and take a listen to your heart and lungs. Is that okay?
Yep.
Okay. Can I ask you to scoot over just a little bit so I can sit next to you when I do this, okay? So the first point that I'm gonna be listening to is your aorta, and it's on the right side at the second intercostal rib.
Cool.
So it's okay if my hands might be a little cold, okay? Okay. Okay, sounds good, very regular and steady. Next, I'm gonna listen to your pneumonic, and it's on the left side at the second intercostal rib. Just gonna go across. Okay, sounds good, very regular, and I'm gonna go Herb's Point at the third, so, sorry, it's just down a little.
It's all good.
Okay, and next I'm gonna listen to tricuspid, which is at the fourth intercostal rib.
Okay.
Okay, and then sounds very good, and I'm gonna listen to your mitral, which is at fifth. So sorry, kind of getting down in here.
It's all good.
Okay. Okay, so sounds good, all normal, which is what we like to hear. So now I'm gonna go ahead and take your apical pulse for a little bit. Is that okay?
Yep.
Okay, kind of get up in your business a little bit, but
It's all good.
so come down from the clavicle, down here. Okay. Okay, it was nice and strong and steady, and it was at 64. And then your respirations were 16, nice and even, steady, just like you want to hear. So now I'm gonna go ahead and listen to your lungs, okay?
Okay.
Okay, so if you can take nice deep breaths for me. Okay, and then go ahead on the other side as well. Okay, I do hear a little bit of wheezing. Can I have you tune to your side so I can listen to your back?
Okay.
Okay. I'm gonna go. Sorry. Look at
Okay.
your shirt. Okay. Can you breathe in for me? Okay. One more time on the other side. Okay. I did hear a little bit of wheezing, and now I'm gonna take it on your lateral. So breathe in one more time for me. Okay. Okay. You can go ahead and sit back to normal. So I did hear a little bit of wheezing on both. So now can I go ahead and take your peripheral pulses?
Sure.
Okay, so I'm gonna go ahead and take your radial ones. I'm gonna just take off these
Remove.
hair ties, kind of get them out of the way a little bit. That's okay. But you're okay. Okay, nice, even, strong. I'm gonna have to take this arm too. Okay. Could you put one of your feet up here on my leg? Okay, so I'm gonna take your pulse on the top of your foot, and then I'm gonna go ahead and take it from behind as well. Okay, good. Both pulses on this foot are nice, steady, even, good. So two, from behind. Okay, both are very good, even. So what I wanna do next is, listen.
Low battery.
No!
Sorry.
Did it stop it?
No, it didn't. Just keep going.
Okay. Sorry about that.
My fault.
Sorry. So now I wanna go ahead and, look at your stomach and everything.
Okay.
And listen to it, feel around a little bit. So could you go ahead and lay down for me? Okay. So I'm gonna go ahead and pull your shirt up a little bit, and your leggings down just a little bit. Okay. So first I'm just gonna go ahead and look at it. Everything looks nice, no discoloration or bulging or anything. So in any of the 4 quadrants. So I'm gonna go ahead and take a listen to it.
Okay.
Okay, so first I'm going to listen to the upper right quadrant. Okay. No abnormal bowel sounds, which is good. I'm gonna go ahead and listen to the left upper quadrant.
Is it still going?
Yeah, it's still going.
Sorry, Becky.
Oh, it's not staying. Becky, I'm sorry.
You can just cut this part out. Maybe.
Okay, so I was listening to your left upper quadrant. Okay. No abnormal bowel sounds, sounds good. I'm gonna go ahead and listen to your right lower quadrant. Also, no abnormal bowel sounds. I'm gonna go ahead and listen to your left lower quadrant. No abnormal bowel sounds, which is good, like we want to hear. So I'm gonna go ahead and feel around on your abdomen a little bit. My hands might be a little cold, so just a warning, okay?
Okay.
Okay. So now I'm gonna palpate your right upper. Feels good. No tenderness or anything?
Nope.
Okay. No masses or anything. Go ahead and palpate your left upper. Feels good. No tenderness?
Nope.
Okay. Your right lower. Okay, good. And then your left lower also feels good. No tenderness in any of those?
No.
Okay, you can go ahead and sit up then for me if you will. Okay, so now we're gonna go ahead and check your range of motion and strength and everything. So if you could please repeat after me or follow what I do.
Okay.
So first we're gonna go ahead and bring our arms over up top. Okay, good. And bring them back down, then out to the side. Okay. Can you bring them behind your head and then down to the lower of your back? Okay, Good. Can you go ahead and put your arms out like this and just kind of like move your wrist around, kind of turn your arms a bit, wiggle your fingers. Okay, looks good. And now I'm gonna go ahead and check your lower range of motion. So at one leg at a time, could you please raise it up for me? Okay, and then if you could put your leg out and then bring it back in behind you. Okay, can you do it for the other leg too? Okay, good. And then if you could stick your foot up and kind of like push down like you're pushing on a gas pedal and then up. And then go ahead and do that with your other one, okay? And then if you could just go ahead and wiggle your big toes for me. Okay, so 5 out of 5 on your range of motion for both upper and lower, which is good, kind of to be expected for someone your age. So now I'm gonna go ahead and test your strength. Is that okay?
Yeah.
Okay. So go ahead and stick your arms out for me. I'm gonna push down, but don't let me, okay? So push up against me. Okay, good. And then if you could have your arm like this to the side, I want you to push in towards your belly, but don't let me push you out, okay? Okay, good. And now we're gonna go the other way, so we try and push it out. Okay, good. And then we're gonna do this to the side too. So don't let me push in. Okay, good. And then, okay, good. So now I'm gonna go ahead and test your legs. So I want you to push up, and I'm gonna try and push down. Okay. Which leg do you want to do first?
I don't care.
Okay, we can do this one. Go ahead. Good. The other side. Good. I'm gonna go ahead and test your hips. So I want you to like push, like try and like rotate your leg out, and I'm gonna keep you from doing that. Okay. Okay. Good. And now we're gonna go the opposite way and try and turn it in. So like turn it in like that. Okay. Go ahead. Okay, good. We're gonna do to this side as well. Good. And then against me. Good. And if you want to go ahead and put your leg up here. So I want you to push down like you're pushing on a gas pedal, okay? Okay, good. And then if we can go ahead and do your other leg. Okay, go ahead and push down. Okay, so good, 5 out of 5. Or good like strength or whatever. So to be expected, normal. And then just so I can test your gait and balance, can you go ahead and get up and walk for me, and then come back down and sit down? Okay, good gait. And then I'm gonna do one last test. Could you please stand up for me and go ahead, stand normal, okay? And then could you close your eyes? Okay, you're good. So Romberg test was negative. Your gait and balance is really good. So thank you for being my patient, and hopefully you feel better soon.
Thanks, nurse. Hi, Becky. Hi.